Hello, we are Student Medical Solutions. I am Bryson, and I am joined with Taylor, Kimberly, Jack, and Skylar. Over the past year, we've been working on a bio-inspired design with the Piedmont Community Care Clinic. The care clinic accepts all adult patients regardless of insurance status. They provide regular checkups for adults, sick visits, vaccinations, and the management of chronic illnesses. The current pandemic has forced the clinic to change care styles with methods such as drive-through visits. Through meetings with the clinicians at the clinic, we have observed that there is a safety risk and lack of efficiency at Piedmont Community Care Clinic between clinicians and patients during car visits. Our solution was to develop an effective protective barrier for vehicle windows and systems that facilitates in-car medical checks. Some of the requirements of this solution must be that it has to be low cost, it has to limit all droplet transmission in and out of the car when closed. It has to be lightweight and able to be used by one person. It must allow for easier communication, examination, testing, and vaccination. It needs to be efficient at being able to be attached and detached, and it has to be able to be cleaned with beach-based cleaners.
So these are our prototypes. So it started as a two-piece moving design, actually quickly turned into a one-piece slot as we realized through feasibility testing that two pieces was not going to be efficient when attaching it to a car. So what we ended up doing is creating a one-piece, essentially a one-size-fits-all shield with a compartment in the middle that allowed the patient to reach through and the doctor to reach through when passing materials or trying to do tests on the patient in the car. So why our shield versus the PPE that is being used today? So our shield is more cost efficient. It's safer to use, which will be shown later on in this presentation. You can easily sanitize it. It's reusable, so you can get many uses out of it. The shield allows for easier patient-nurse communication through the window instead of using a lot of face shields and PPE that can possibly create a communication barrier there. It's a more efficient, so putting on a shield over the car will allow a quicker visit and an easier experience when they drive through the drive-through. And it's innovative, so as technology is changing throughout time, the shield is going to develop and can develop into other future prototypes. So the net cost over time versus PPE that's being used. So this data is based on a face shield, gloves, mask, and a gown that is being used today. So the price per visit of using PPE is just over $3 versus 60 cents when using our shield. So after 26 visits, the shield will pay for itself.
Our Biodesign device weighs a total of 5.4 pounds and the acrylic shield measures 35 by 23 inches. The lightweight and compact design allows for easy storage and efficient placement on or removal from a vehicle that can be completed by one person. The thin acrylic material successfully creates a protective barrier but allows for clear communication between the patient and clinic staff. The material is durable and can withstand bleach-based cleaners utilized between visits. The design features a magnetic strip that can be used to attach a basket, markers, or hang patient documents that can be utilized if multiple staff are completing one visit. The portal door in the center of the device measures 8 inches by 8 inches, allowing for easy passage of papers or other necessary medical devices needed to complete a variety of visits at the clinic.
In order to test the effectiveness of our shield at stopping airborne particulate matter from exiting the vehicle, we did a spray test to simulate a cough or sneeze by the patient. This was carried out in 4 different stages: window closed, window half open, shield on, portal closed and open. We did not.
This is the results of our airborne droplet dispersion test. We used ImageJ to analyze the amount of droplets that made it through the window in each condition. And as you can see, the shield with the portal open did pretty well compared to the window half open and the window fully open. This is our verification for sound testing. We used a constant audio of conversation similar to what a patient would have with a physician, and we measured the decibels with a sound meter through closed shield, open window, and closed window. As you can see, the shield allowed for good communication.
So for the future of our design, we have found that the prototype works to limit airborne particle transmission, and it allows clinicians to communicate and facilitates a variety of physical exams. The cost of the shield is low, it protects against waste, and it saves money after 26 visits when compared to a full set of PPE. The shield has a simple and modifiable design that can be mass-produced very easily. The black friction mat that secures the shield to the car can be improved upon by being made lighter with the addition of suction cups for a more secure fit. Other modifications can be made at the user's discretion for various applications. We hope you enjoyed our presentation